All right, good afternoon, everybody. Thank you for joining us here on April 1st for the daily media brief for the city of Louisville, the great city of Louisville, Kentucky. I want to start by saying a happy Census Day to everybody. Today, April 1st, is Census Day, and even though we're focusing on other things, it's still important to remember that we've got all kinds of responsibilities as citizens, and being truthful and reporting on the census is one of those, and I'll talk about that more here in a second. So now let's talk about our latest COVID-19 numbers. As of the most recent update, there are 228 positive COVID-19 cases in Jefferson County. We all see by following the media how serious this is in terms of numbers going up, and then unfortunately fatalities as well. Yesterday was the first day in the country where we had more than 500 deaths related to COVID, and I am very sad to say that we've had one additional death to report here in Louisville. So our total so far is 8 deaths related to the COVID outbreak. So our thoughts and prayers with the family. Today's count of 228 confirmed is an increase of 22 over yesterday. Again, we knew we'd be seeing more cases as the amount of testing we have is increasing, but also we just know we have a lot more community spread going on. There are a lot more people infected in the community than 228, but we see that's our case number right now. So what that means is we're finding more of the cases out there, and that is essential then to slowing down the spread of the disease. When you compare us to other cities, we're not seeing nearly the volume of cases that are being seen in Seattle, New York, Detroit, obviously, though it's bigger cities than ours. New Orleans is about the same, a whole lot more. And now Cleveland, Kansas City, Indianapolis. So as I've said the past couple of days, this virus now is multiplying much more rapidly in the Midwest and the southern parts of our country right now. Our Metro Incident Management Team reports that our hospitals are treating more and more COVID-19 cases, but we still have more than adequate bed space available in the intensive care units and isolation wards to treat COVID-19 patients. So we're sharing data back and forth with our hospitals and many other partners every day. We're also working around the clock to make sure that our doctors, nurses, hospital staff, and all first responders continue to have the materials that they need. And one of the ways that we're doing that is by monitoring conditions and forecasting what the next few weeks and few months could look like to make sure that we're ready. And we all know there's a lot of moving targets, a lot of moving variables with predicting when we're going to peak. But I'd like to share some information from a new report from the Institute for Health Metrics and Evaluation at the University of Washington. According to their projections, Kentucky will hit our peak positive cases in mid-May. So we would continue to expect to see increases going up to them. As I said, that's a lot of variables involved with that, so that could change, but that's their latest forecast. Now, there is a brutal reality to this, and part of what we have to do as a community is obviously keep the spread from happening, but we also have to prepare ourselves for potentially what could be happening in terms of fatalities from this COVID-19 virus. And that's why we're trying to keep everybody apart from spreading this disease. This forecast from Washington, state of Washington, and it's the one, if you're following the national media that is being referred to by everyone, indicates forecasts that our state as a whole could see over 800 deaths from COVID-19 by August. 800 deaths by August. White House coronavirus coordinator is also using those estimates, and those estimates are lower than others that we've seen already. So if you break that projection down to the city level, and it doesn't always work exactly this way, but it will work roughly that way. Louisville is about 1/5 the population of Kentucky. So if Kentucky has 800 deaths, we'll see somewhere between 150 and 200 deaths here in Louisville. So put your mind around that for a moment and ask yourself, who could that be? Is that somebody that you know? We'll all know somebody that's been affected by this in terms of illness. I hope we all don't know somebody that's been affected by this with loss of life, but when we're getting up to these numbers, that's what we're talking about here. So, folks, again, that number is totally unacceptable to any of us. So we have to do everything about it. The good news is we know what we can do about it. And you know what that is by now, right? Stay home, wash your hands, stay away from sick people, limit your outings to essential outings. You got to go to the grocery store, go once a week. You don't have to go once a day. Those are all things you can do to limit spread. I want everybody at the end of this to be able to look themselves in the mirror, especially those of you that are going to know somebody that's been severely ill from this or somebody that's died from this, and you can at least say, I did everything I could to be responsible to try to prevent the spread of this disease. And that's what most everybody is doing. I got to say, I'm very grateful. I'm very proud of our community. For the most part, everybody is doing their job in terms of fighting this virus right now. And when you think about our city, we are overwhelmingly kind and compassionate and a hospitable city of Louisvillians, and that's what we're seeing. But we need everybody, every person to get on board. If you're not on board right now, we need you to get on board. Our police officers are still reporting that we're having to break up crowds of people. If you're in a crowd of more than 10 people, don't go there. You just got to go away. You got to stay 6 feet apart from each other, even if it's a smaller gathering in a park or what have you. Also, we're still seeing reports of businesses that aren't complying with social distancing guidelines as well. You get in order. If we send somebody out there and you're not in place, we're going to have to shut you down. We do not want to do that. Okay, but there's been plenty of warnings and plenty of guidelines that have gone out by now. So you are advised. Please help us. If you have to get outside, we are encouraging that. It's a beautiful time in springtime here in Louisville. But whether you're on a park, whether you're on a golf course, whether or not you're taking a walk, remember, still 6-foot social distance. The disease, the virus, transfers through you through droplets, and when you're closer than 6 feet, you have a very good probability of getting the virus and transferring it on. So no problem getting exercise, fresh air. It's good for us. It's good for our mental health, but follow social distancing guidelines. Okay. So everybody, please think about all the people you see as somebody you love. You may not love them, but think about it that way and show them the same kind of courtesy and compassion you would expect that they would give you so that you don't get the virus. Okay. So that's who we are as a city. We've demonstrated that time and time again in terms of kind and compassion. And I got to say, we're almost there in terms of everybody helping out and everybody complying. So it makes me proud to know we're doing that as a community. And I'm very grateful to the community because these are tough times. And we're asking people to do unparalleled things in terms of staying home. And when you think about the weddings that were planned right now, you think about the funerals that are taking place where people can't come to the funeral. I mean, that is hard. But that's what we're going to have to do now. So thank you, everybody, for what you're doing. And let's keep spreading the word for social distancing, okay? Let's just be really clear. This is life or death. There are tools out there that can help us. One thing that will help us is if we use all of those tools that we have available to us to stay safe and keep those around us safe as well. And one of those tools I want to talk about briefly now is called Smart 911. This is a service that can help first responders reach you more quickly. And when they do, they'll be armed with more information, better information, unique to you, that you may need to take care of you and potentially save your life. And so here's a short video with some information on Smart 911. I'll start talking about Smart 911, and if the video pops up, I'll stop at that point in time. Here's how it works. You go to smart911.com, to sign up or get the Smart 911 app for your phone and then fill out your profile. Let's go to the video. Maybe not. Okay, looks like we're having some bandwidth problems there. Okay, so smart911.com. You can either go there or get the Smart 911 app for your phone, and then you fill out your profile. So the information you share will help first responders when you have an emergency. And it's going to ask you what you want them to know. For instance, it's going to ask you about your family's medical history, how many members in your family, do you have pets in the house? Let's try it again. Okay, so by getting that information around your medical history, number of family members, their medical history, do you have pets in the house or not? Someone you want notified because maybe you live alone. If a neighbor has a key, so that there's a faster way to get to you. Sometimes EMS might need a code to get into your apartment building. Things like that is what it's going to ask you so that it can give you more one-on-one unique care that you might need so that we can take better care of you. So if you're signed up for Smart 911 and you call from the number that you've registered, your profile then shows up. So our 911 operators know immediately who you are. And then that gives us name, address, and other vital information. So you can see how important this is to make sure we're giving you the best that you have. So the Smart 911 app improves your cell phone's GPS location also, and that data gets sent to 911. So it also makes it easier then to find you if you're lost somewhere. Okay, so with Smart 911, you also get the Louisville Emergency Notification System, also known as the Lens Alert. And it's how your local government can notify you about emergencies using voice, text, or mail. We've been sending alerts out during this COVID-19 crisis through Lens Alert. So it keeps you informed, gives you a heads up so that you can take better care of yourself and those around you. The information that you give Smart 911 is kept secure, and it's only available to responders when you call in with an emergency. So there's millions of people all across the country right now are using Smart 911, and it saved lives. It demonstrates that. So please be smart and sign up for Smart 911 today. You'll be glad you did. It helps all of us and helps us take care of you. All right. This virus is affecting every aspect of our city and every aspect of our society. That includes every department within city government, and that includes our Department of Corrections and our jail. I do want to report that we've had one member of our Metro Corrections staff test positive for COVID-19. So naturally, we're taking the appropriate steps to protect the health and safety of that staff member and the rest of our corrections team and our inmates. I'm joined now by Dwayne Clark. He's the director of Metro Corrections, 4 decades of experience all over the country. He's been in Metro now for over a decade and is just a highly respected professional in the corrections industry. And Director Clark is going to give us a little update about what's happening inside of the jail. Director?
Thank you, Mayor. Today, as you said, we had our first employee test positive for COVID-19, and there are no positive cases in our inmate population. We have began testing our inmate population. We have tested 23 inmates to date, and there are 17 negatives, and the remainder are pending, 6 pending results for the test. Metro Corrections, we've stepped up our cleaning and to include disinfecting hard surfaces, frequently touched surfaces such as countertops, tabletops, desk handles, doorknobs, light switches, railings, and many other frequently touched items. We're going through some education on educating our inmate population. We put posters in dorms, hung them in hallways. It also stands as a reminder and to our staff, and pretty much some the things that we know that will defend us or defend the COVID-19 virus. Wash your hands frequently, at least 20 seconds at least 20 seconds. Uh, Cough, sneeze, cover it with your elbow or tissue. Immediately throw that away in the garbage. Avoid touching eyes, um, and keep safe distances when possible. So those are some of the things that we're educating our staff and inmates on. Um, and also we're doing some things on the front end that we have started several months ago. In front of this is we're taking uh, temperature checks of anybody being booked into the jail. We're taking temperature checks, and any staff reporting for duty, we're taking temperature checks. Anybody reading over 108 staff-wise, we will send them home and they will self-isolate. And then any inmate coming in, being booked in, who has a temperature more than 108 degree or 100.3 degrees, we are isolating them and segregating them with like prisoners. And for the 14 days, we are also through tests, and anybody who's reporting or exhibits flu-like symptoms, high temperatures, things of that nature, we're separating them and isolating them. And also, of course, we have a medical director here, Dr. Smith, who is also monitoring and tending to their health needs with a host of nurses and other staff, medical staff. So we've also worked real close with the criminal justice partners to reduce our count. March the 1st, we started reducing our count. We began at about 1,850 inmates, and today we're down to 1,440 inmates in our custody. And what that does by helping us reduce is help us keep this place safer, so we can practice some separations, isolate those that are persons of interest. It helps us isolate, have more room to isolate, move people in various different stages to help us get through this. And we also, if we have positives, which we have none to date, and we contact the public health and wellness, and they help us manage through, help us make decisions on how to handle those cases. But all they public health and wellness has worked real well with us, and good partners. They've done an excellent job with us here, and although we've had some experience at this before, not necessarily COVID-19, but we took a lot of our plan, modeled it after the Hep A situation that we went through a couple of years ago here, that Unity and this center found itself going through. But right now, you rest assured that we have a plan, and we will end up with COVID-19. It's just reality. We've checked with other communities and jails around, and they've got it in their community, and it came to their jail. We have a plan prepared that we will follow. We will get through this. Thank you.
Okay, thank you, Director Clark. There were a bunch of media questions related to the jail. I think you answered them all in your brief there. So if there's some others, we'll come back to those at the end of this. But I want to say thank you for that. You know, a lot of people don't appreciate the what goes on inside of the jail. We've got a lot of professionals in there. You know, they work behind the closed walls there, and so they're not out in the community. But we've got a great dedicated team of staff, both our professionals working on the floor, in the dorms, every room, on the dorms rooms, and in the offices. So I just want to say thank you to you, Director, to you and your team. And I know we've got some good news in that we've got a class of 11 new recruits who are about to graduate from the Corrections Academy. We're having a virtual graduation, I guess, in keeping with the times for that. So I want to thank them on behalf of our city for joining the Metro Corrections team and being part of our public safety team here in the great city of Louisville. It's an honor to serve alongside of you all. As you know, I like to visit the jail and see what's going on and some of the incredible work that y'all got going on there, especially when it comes to detox and recovery and preparing folks to go back into the community. The national honors that you all received because of that are richly deserved. So thanks for what you're doing, and I look forward to visiting you all back in the jail here sometimes too when that's the right thing to do. All right, so thank you.
All right. Thank you, Mayor.
A few other thank yous I'd like to make relative to corrections. We're always working to keep the jail population appropriately low. So I want to thank the following partners that have helped us to do that, to be at about 1,440 inmates right now. I mean, that's in a jail that our capacity is in the 2,000 range or so, is where we like to be, low. The folks that have helped us, great work from our Commonwealth Attorney, Tom Wine, and County Attorney Mike O'Connell, to extraordinary elected officials, public servants, and Jefferson District Public Defender Leo Smith. And all of these folks have worked to identify individuals in the jail who we should release, expedite their releases, so we can do that without compromising public safety, obviously, by the nature of their offense. Also, I want to say a big thank you to the members of the judiciary for their willingness to review cases and to hold remote hearing for persons who remain in custody so that process of justice keeps moving, because the justice process is a very much an in-person process. So adjusting that to this virtual world, people have worked very quickly to do that. Chief Circuit Court Judge Angela Bissig and Chief District Court Judge Ann Haney have put in considerable time and effort to work through the challenges this virus has caused for the bench and the bar. And they've taken on the difficult task of balancing the constitutional rights of the accused and the voice of the victims during this crisis. So I want to say thank you to them on behalf of their city and everybody working in the justice system in these challenging times. So thank you to the team. Once again, we all pull together as a city. I also want to thank Kentucky State Supreme Court Justice Hughes for her involvement and communication with our office on how we can make progress in these areas we've just described. So good job to the whole team. Okay, now let's switch over to another really important member of the team, and that is Jefferson County Public Schools. Think about how their world's been disrupted these past 3 weeks. So I want to send a big thank you to everybody working in education for their dedication and innovation day in and day out, but especially in these trying times, to make sure the children of Louisville keep learning even though schools are closed. We all know about that summer melt in learning and education that takes place in the summertime. We do not want to have a COVID melt that comes out of this. So I was really proud to join a virtual press conference today with Dr. Marty Polio, the superintendent at JCPS, to celebrate the announcement of the school district purchasing more than 6,000 mobile Wi-Fi hotspots and 3 months of service to support JCPS students with special needs. So that increased connectivity will allow students to continue receiving therapy by video chat with their school therapist while they're learning at home. So, we call this digital equity, right? So everybody has access to the internet, just like everybody should have electricity water. Everybody needs to have access to the internet, but in our community, not everybody does. So this investment by JCPS goes a long way toward filling that equity gap. So I want to say thank you to JCPS for that, and also reiterate to the community that JCPS is also distributing Chromebooks to families that do not have a device that's adequate for schoolwork. So far, 15,000 JCPS families have signed up for the Chromebooks. They're going to be mailed out today. They have 10,000 more. So JCPS has extended the sign up for families to 5 o'clock tomorrow if your family does not have a device. If you have a device of some other kind already, you don't need these Chromebooks, and please don't sign up for one. Okay? So I think it's just a tremendous job by JCPS. Another example of a great organization really leaning into this in these tough times in the community. So they've shown that through now the digital equity and going online with their classroom trainings on Monday. But also they're passing out 36,000 meals throughout the community every day to their students. So whether it's that or providing this non-traditional instruction, they've done a great job. So thank you to the teachers, the staff, all the parents. I want to thank Grace Simrall from my team, our Chief of Innovation and Technology, for working with JCPS on this project, and David Jones, who called me a couple of weeks ago and said, I want to take on a big project, knowing about his passion for education. We asked him to help with this digital inclusion project. So they all work together with JCPS and many other partners to get this done. So good job, everybody. All right, now let's shift gears to another aspect of life in our city, which is essential service, and that is trash pickup and yard waste pickup. These are areas that we got to look at differently now through the lens of COVID-19. Our sanitation professionals, they're one of the many unsung heroes of our communities. I mean, how often do you see these guys out there doing their thing and you just kind of take them for granted? They take care of us. So let's make sure we're taking care of them also. So we're concerned about the risk of infection to COVID-19 through our waste collection. And then that would go to our waste collection workers. So I'm asking residents to make sure that all household garbage is bagged and tied closed before being placed inside city-issued or waste hauler-issued garbage carts. Okay, so put your garbage in a plastic bag, tie it up before you put it in your garbage carts. And then as an added precaution, if your garbage cart fills up before your collection day, please place any additional garbage bags in a reusable container with handles so our sanitation professionals can pick it up by its handles, dump it into the garbage truck without contacting the garbage directly. Okay? So again, think about those, our garbage professionals as your brothers and sisters. Treat them with the same respect you'd want to be treated. I'm happy to report that's almost what everybody does in our community, so nice job on that. Now let's talk about the other thing that's happening since it's springtime. We've been saying get outside, get some fresh air. We can see that a lot of people are doing that by the yard waste that they've started setting out by the curb. So yard waste collection crews will resume normal curbside collection service on April 13th, 12 days from now. This means no requests will be made for pickup. So crews will work their collection areas till the completion of the route is finished or until dusk. If the yard waste route is not completed, the crew will pick up where they left off on the day prior. If you have yard waste out right now, what you do is what you've done always is go to louisvilleky.gov, the Public Works Department, and request a pickup. And when we have the capacity, they'll come and get that for you before we start normal collection back. So again, go to louisvilleky.gov/garbage. Okay. All right. So what's our goal with all this? Obviously, slow the spread, right? Beat this virus. So we've been guided throughout this by our public health and wellness professionals and our chief health strategist, Dr. Sarah Moyer, who is now going to join us for her observations of the day. Dr. Moyer.
Thanks, Mayor. So just want to echo your thanks to our Metro partners that have been working alongside of us just to make sure first responders and community remain safe. So really shout out, thank you for corrections and waste management that are on the phone today. Really appreciate all the work that you've been doing working with us. Here today to remind everyone that the virus does not move. It's the people that move, and the virus will stop moving when people stop moving. So the sooner we stop spreading the virus, the sooner we can all come out of quarantine. So please stay home, let our essential service workers and first responders do their work. I've talked before about the symptoms of COVID-19, typical ones being a fever, dry cough, and trouble breathing. But as more and more people are getting COVID-19, physicians are now seeing a few other symptoms that may occur in some people. And we're starting to maybe see this as an early signs of the virus. And so just wanted to make sure you were all aware as well. So you can, another reason to stay home and help us stop the spread of the virus. Be watchful for these symptoms, even if you've had close contact, especially if you've had close contact with somebody with COVID-19. So other symptoms besides fever, cough, and shortness of breath include some gastrointestinal symptoms, particularly some stomach discomfort with some diarrhea. We've been seeing some nausea without vomiting. According to a new study, a subset of COVID-19 patients who all had mild disease overall had what we call GI symptoms in medical terms, and respiratory symptoms, and some never even developed respiratory symptoms at all. The second one is some people also reporting losing their sense of smell and taste. These people tend to be regaining them once they've recovered, but losing your sense of smell could be an early symptom of the virus, and could be a sign that you're spreading it. And so if you find that you've lost your sense of smell, another reason, please stay home. The third one is malaise and fatigue. A recent report out of Washington Nursing Home, nearly 1/3 of the residents tested positive for the virus, but half had no symptoms. And a few of these people were reporting unusual things like malaise, which usually is just as discomfort, just not feeling right, uneasy, and tired. And so just watch out for that as well. And then lastly, headache and dizziness may also be another sign of the virus. Another study came out, showed about 8% of people were reporting headaches. So just be mindful if you have a headache, could be COVID, could possibly not be. But as we continue to be cooped up in our homes and we keep hearing news about the epidemic, I know it's on 24 hours a day, it's not surprising that we could also feel anxious, uneasy, tired, exhausted, and all these symptoms as well sound like what I just described. So if you start to feel like you're getting stressed about this, just please make sure you're doing all the great things the mayor and others have talked about. So whether it's meditating, taking deep breaths, getting outside, getting some sunshine and walking, doing something that makes you laugh are all great ways to really try to discern if this is stress reaction or if it might be an early sign of COVID. So just more important than ever that we continue to stay in our homes and only go out to get necessities like medicine and food. And so just want to shout out thank you to everyone that's already doing this. You're really helping us control the spread of the novel coronavirus, and you're saving lives. So just want to remember that this is an emergency scene. I mean, it's much just like a tornado or an earthquake or a hurricane, where we, at another natural disaster, where the public would be told to avoid the area so we as first responders and healthcare providers can do our job. And so in this case, there's not a train that's derailed that we're telling you to avoid. It's everywhere. We are asking the public to do now to stay in their homes so we can limit your movement, so we limit the movement of the virus, and we have stopped the spread. Everyone that catches COVID-19 makes our job as first responders and public health and healthcare workers and our essential workers' job more difficult. We can respond, we can do this, but we need everyone's help. So please support us, support your first responders, support your essential personnel workers that are providing us food and utilities and everything else that we need to be able to stay home. We can defeat COVID-19, but we need everyone and we need you. So please do your part, and thank you for that.
Thank you, Dr. Moyer. And you're right. I mean, there's so many people helping and doing the right things that it's pretty uplifting, really. I mean, we're in the midst of something bad, but a lot of people doing amazing things. So thank you for remembering all of them. All right, as we're winding this out before we take the media questions, as I said before, today is National Census Day. This is the day, but there's time to respond. So you can still respond after today. And if you haven't done so, please do so. I think I've mentioned before that it took my wife and I about 10 minutes to do that online. Before she was positive coronavirus, and she's now out of isolation and doing well. I mean, a little tired, but I'm grateful that she's a lot better. So everybody, please answer the census questions as soon as you can. The Census Bureau is taking responses for the next several months. And in fact, if you haven't responded yet online, you'll get a paper form in the mail starting next week. Look, it's really important that we have accurate census data because our population determines how much federal funding flows into the city for education, for healthcare, for public safety assistance. All aspects of our life are impacted by the census. And it only happens once every 10 years. So this is our shot. And our population compared to the rest of the country determines the relative share that we get from the federal government. So it's really, really important. So please make sure your friends, your family, and your social networks know about the importance of responding. And responding now will minimize the need to send census takers out into the communities to follow up. So please help us out. And if you haven't filled out your census form yet, go to my2020census.gov. Okay. Excuse my allergy here. All right. Now let's close with a Lift Up Lou message. As we continue to mention all the time, there's a lot of amazing things happening in the community, a lot of beautiful things happening in the city. You've heard about that today. JCPS has been incredible. The One Louisville COVID-19 Response Fund has been a huge success. The team at our Resilience and Community Services has been on the front lines of this, sending money to folks that have been impacted by the virus, to nonprofits. They served up more than 9,000 frozen meals to over 1,800 seniors today through our March for Meals program. And since the program began just 2 weeks ago, they've provided more than 13,000 seniors with more than 68,000 meals. That's awesome. Think about the gratitude that each one of those meals comes from. So whether it's that program or the 30,000 that JCPS hands out every day, that's great work by our community. I also want to thank everybody with the Lift Up Lou sessions are growing each and every day. People are kind of adopting that into their rhythm of their day. And so it's their workouts, storytelling, music. There's information on the census. You can find out more about that on social media at Lift Up Lou. Tonight and every night at 7 o'clock, they close out with a mindfulness session, a little chill session. And we could all use a little bit more mindfulness these days, but any day for that matter. So tonight, the theme is love is the oldest medicine we have. And who can argue with that? And that's presented by the Center for Interfaith Relations. So tune in to at Lift Up Lou at 7 o'clock tonight on Facebook, and other social media platform. And tomorrow, I'd like to invite you to join me at 10 a.m. for one of our teletown halls on Facebook Live. My guest tomorrow will be representatives of all three of the hospital companies in our community. So think about all the questions we've got about healthcare and capacity, what they're doing inside the hotel, how our healthcare workers are being impacted by this. That's going to be a really interesting conversation. So please join us at 10 o'clock on Facebook Live at Louisville Mayor, and check out what's going on in our healthcare community. Okay, so with that, we'll go to our questions right now. David Mattingly from WAVE, hello David, is saying models being used by the White House from the University of Washington show the peak demand for ventilators will peak in the middle of May and predict a shortage of 187 ventilators. How accurate do you think that will be? I referred to that earlier in my remarks. These models are going to be changing as we move through the virus. Obviously, that's 6 weeks from now. It's probably directionally correct. Tomorrow during the town hall at 10 o'clock with the healthcare professionals, let's ask that question as well. There's a lot of technology being used on existing ventilators that are being put out there right now that fortunately we're kind of not in the first wave of this virus by any stretch of the imagination. So we'll know on whether or not you can start having 2 people serviced by 1 ventilator or 4 people, for instance. So I think the peak is probably directionally correct. It could change. We're tracking those numbers every day. So if we start seeing this spike, we'll be talking about that spike. Right now, we're seeing gradual movement up, down a little bit, but not a big spike coming to us right away. And that means what we're doing as a community is successful. So let's keep up our social distancing. Okay, lots of questions in here about GE Appliance Park. So let me give you an update on that, and then I'm going to ask Connie Mendel to come on and talk to us about it. GE Appliance Park is classified as an essential business by Department of Homeland Security. So they can't operate. They have to operate in a safe and healthy way, though. Okay, so those are the things. You can't operate, but you got to be safe and healthy. So how do you do that in a manufacturing environment? GE has made a lot of changes inside of their facility. They and the union, the workforce needs to say, okay, it looks like we could get something done. Until they're not, they're going to have to keep working, obviously, to get to that point. So yesterday, 2 members of public health conducted a 3.5-hour on-site complaint investigation of GE, and they were accompanied by both GE management personnel and a union representative. So that's important that everybody is on those walkthroughs. So that's the big picture on it. Connie, are you on the line right now? Connie Mendel from our public health team. If you're on and you're picking up, just interrupt me. Or Sarah, do you have something to report on this?
She was on the line, but no, just exactly what you said. The team spent 3.5 hours out there yesterday.
Connie, you on?
Yes, I'm here.
Okay, Connie.
Sorry about that.
Okay, thanks for joining us. We know you've been a little busy. So you want to fill us in a little bit on what you see going on at Appliance Park, please?
Sure, absolutely. As you mentioned, GE has made significant and they're continuing to make efforts to ensure employee safety and sanitation. So our management, environmental health staff were there. It wasn't perfect. What we saw, it was generally clean. The typical things that you would see for a very large manufacturing facility and a lot of employees, small amounts of debris or litter. But they were cleaning while we were there. We didn't pre-schedule the visit. We did give them a few minutes heads up to meet us at the security area. The areas that we visited were specific areas that were phoned in from employees. So we had a list of places that we wanted to see while we were there. And we went in, we saw both the refrigerator and dishwasher manufacturing line. They spent most of their times in building 3 and 5, but they did go into restrooms, locker rooms, break rooms, clock-in areas, in the food and PPE vending areas. Like I said, there was the typical wear and tear that you would see with a plant. We did provide them with some additional guidance. One of the things is that staff need just frequent reminders to overcome that normal tendency we have to be close together. We're very social people. The facility is loud, so you do see people, gathering together. So there just needs those constant reminders to maintain social distancing. We had some guidance on maybe more frequent cleaning of frequently touched areas, those touch spots that you've discussed in other areas, and we'll continue to respond and to the calls that we get in through 311 through there and throughout the city. So, our staff are making calls throughout Metro Louisville.
Great. Well, thank you. I know you guys are busy always, but you're super busy now. So thanks, Connie, for that. Just kind of a general message to both GE and the workforce. We've got to work together, right? And GE has got to be looking at the sustainability of their business and how long that they can be down. They also, I know they are working through the lens of it has to be safe as well. They don't see, they're not saying, well, let's just go ahead and do this and it's unsafe. They know that's not a winner either. So there's strong desire, I believe, on both sides here to have a safe facility so that they can operate and then they can sustain the business and grow the business as well. So that's the kind of balance we want to see, with emphasis on safety, safety, and health, health, health. So just encourage all parties to continue communicating. We'll provide the public health guidance from Connie and her team to make sure that everything's appropriately in place. So Connie, would you like to add anything to that?
No, I think you covered it. Thank you.
Okay, very good. All right, Fallon Glick, there's a question in here about inmates at the jail. There are so many questions about the inmates at the jail on here that I'll ask Gene Porter if it's probably best if you just take all these. Dwight Clark responded to many of them, but there's several others. Let's just put out a whole list of answers to all these so we can just put it out in writing. That'll be the most comprehensive way. Otherwise, we'll be on here for half an hour talking about these things. Okay.
We'll do that.
All right. Thank you, sir. All right. The question on here is, this is from Fallon Glick also. Can you please address the alleged scam testing sites in the city? And is the city doing anything to prevent these? And what message do you have to the community so no one falls victim to these scams? Okay, so look, there's a lot of scams right now. Unfortunately, there's a small percentage of the world population and national population and local population that says, oh, we can take advantage of people right now. So if there's something out there that sounds too good to be true, it is. If it feels sketchy, it probably is sketchy. So, follow your intuition and gut on that. On the pop-up testing, yes, we have observed and we've received calls about multiple pop-up testing sites in the city. These matters have been referred to law enforcement for further review and possible action. And we were not consulted. Louisville Metro government was not consulted prior to the site's opening. And at this time, we're advising residents that are experiencing symptoms to seek COVID-19 testing through their healthcare provider. Okay, and so call your physician or family health center beforehand so that you can make sure that you're getting tested properly and that you're not paying. Heard one of these test sites is like $240 cash. That's not the way to go. Okay, so law enforcement is now taking a look at this. Everybody has an obligation, if they're doing this legally, to report their figures as well. So we're concerned about these pop-up sites that are you're seeing in the city right now. So more to follow on that, but we're telling folks that, don't do that. I wouldn't do that. You've got to go through your normal channels, okay? All right. Will the city, this is from John Wise at Wade, will the city publish a list of legitimate drive-through testing locations? We can certainly provide that list. There's not a lot of them. Most of them are hospital-based, if not all right now. So I'll ask my communications team to follow up on that, okay? Let's see, pop-up sites, jail questions, and then is the city preparing for the avalanche of potential evictions for businesses and renters? And are there preventive measures or relief plans in the work? Okay, so I guess we got two different questions here. If you're an individual or family, there are no evictions taking place in the community right now. LG&E, water company, all those services are continuing. If you somehow, either as a homeowner or as a renter, have a federal guarantee to your mortgage, I believe the relief period on that is a year. Okay, so if there's any of these evictions being taken place right now, we want to know about those. You can contact 311 and give us the details. They should not be taking place. On the business side of this, we've been asking landlords to work with their tenants. I mean, the question that I'm asking landlords is who's going to come in to the space after you evict somebody? So most people are working it out, right? So trying to get through all of this. The federal relief packages are very significant to this. because there's some immediate grants of $10,000 available in there. The Payroll Protection Act is a way for people to keep their employees and pay their rent, and they're on there. So everybody get familiar with what is available through the Small Business Administration. You can go to SBA online and see that. You can go to louisvilleky.gov and see that as well. That's on the small business side. And on the personal side, get familiar with the $1,200 checks coming to taxpayers and the $500 per child. And then the One Louisville COVID-19 Relief Fund is also available for people to help pay rent. And you can go to louisvilleky.gov, click on the top left, and check the eligibility out for that. So there's a lot of ways that you can work your way through this thing. And our job is to help make sure that we're helping you get through with everything you can. Okay, so I'm looking through the rest of the questions right now. And it looks like that's about it. Oh, there's one thing in here, Dr. Moyer. Are you or the health department aware of any confirmed positive cases at the Masonic Home Nursing Home in Louisville?
Yeah, so all the details about cases, I mean, just with everything, the health department has advised that COVID-19 is everywhere, and so cases are popping up everywhere. Dr. Cloya came on Monday to explain that when we have a case with a certain employer in a certain area, advisory is going out to that employer, and they're notifying people that are at risk. So if you're an employee at a place that has had a case, your employer should be working with you to notify you if you're at risk, but otherwise, just assume every time you leave your house, you're putting yourself at risk. So that's the general advice, and be careful out there.
So are we're not commenting on if we know if there's a case at a specific nursing home?
The health department's not. If that employer or a certain place wants to put out their own press release, we're not stopping that information. But right now, the general advice from the health department is that COVID-19 is everywhere. Usually, in prior situations, we would put out a press release if the public was at risk. Right now, all public's at risk, and so there is no need to do extra notification. But if you are an employee in a certain place and you're at extra risk than the general public, then they will notify you.
Okay, thank you for that. We will. Remember, obviously, we've been talking about this for weeks, and that's why we've encouraged strong restrictions of visiting at our nursing homes because of the nature of the at-risk population in the nursing homes. Okay, that answers all of our questions here for the day. So again, we'll address this myriad of questions on the jail through a release that Gene Porter will put out later today. Okay, so again, thank you to the media. You guys are really working hard, and it's so important that we're getting the correct news out right now. So thanks for your assistance on this, and we'll see you at 4 o'clock tomorrow. Take care.